Good morning, everyone. My name is Abigail Aguilar, but you can just call me Abby. A bit of a background about me is that I will be a new grad nurse next year and feeling a little overwhelmed and scared with how things will turn out when I start working as a registered nurse. Most of us will be new graduate nurses next year, and I just want to acknowledge that you are not alone with this daunting but rewarding journey of our lives to becoming registered nurses. This morning, I will be discussing the effects of shift work and long work hours, as it can potentially risk patient safety and inhibit a healthy workplace. First and foremost, shift work and long work hours is quite the backbone of nursing workforce. Discussing this topic using evidence-based research is an important component of well-informed education because it can transform the quality of healthcare we deliver. This will help us as new graduate nurses identify safe policies and protocols so we deliver safe and efficient care and working within our scope of practice to improve patient safety and have a healthy workplace. This discussion is done using a PowerPoint presentation to show initiative as role models as we are the future nurses of the patient safety and healthy workplace begins with you. So today, we are going to learn a few things why this begins with us. We are going to understand the concept of patient safety and healthy workplace, such as what do these terminologies mean. We are also going to learn to understand the presenting problem, how shift work and long work hours affect patient safety and a healthy workplace. In addition to this, we will also learn the policies and strategies that are currently implemented to help uplift the problem. It is not just these implemented strategies that will help, but also knowing our roles and responsibilities and knowing your scope of practice as new graduate nurse to lessen the prevalence of the problem. Lastly, we are the future nurses. We are the future leaders of the healthcare industry. Therefore, we must know or learn how to increase patient safety and providing a healthier workplace through empowering clinical leadership. So, what is patient safety and what is healthy workplace? Patient safety is preventing errors or adverse effects to patients who are under a healthcare team, while healthy workplace involves providing spaces where everyone can work together to achieve on the agreed goal. It also allows the workers to improve or control their own health. Nursing is a challenging profession that requires engaging and inspiring role models and leaders. Today's world is changing and increased its demands. Its fulfillment is one of the greatest challenges of the nursing profession. Nursing shortages is associated with the increase of workload, leading to the solution of increasing shift hours or doing shift work, that it has become the nature of the job. Shift work is a work or a shift that is scheduled outside the traditional hours or out of daylight hours, which includes night shift. Long work hours, on the other hand, is any fixed system of more than 8 working hours in a duration or consecutively. So, why is shift work and long work hours a problem? Work schedules can often be influenced by the time of shift, direction, and speed of shift rotation, patterns of days off, shift length, and break. Shift work and long work hours are made to alleviate the staff shortage. It has become a problem because scientific evidence displayed that these shifts have detrimental physiological and psychological impact on our health, such as disrupted circadian rhythm, sleeping disorders, health problems, decrease in productivity at work, job dissatisfaction, increased errors and adverse outcomes, and social isolation. Now, let us have a look why and how shift work and long work hours is an issue that affect patient safety and healthy workplace. Let us have a look at the physiological effects. Firstly, we are human beings, and we all have specific physiological factors that allows us to function well throughout the day. Shift work and long work hours can disrupt the circadian rhythm, or what we all know as sleeping pattern. Humans are diurnal, meaning we prefer to be active during the day and rest at night. When this synchrony is disrupted, it breaks the temporal cues such as meal times, noises, clocks, exercises that adjust our circadian rhythm. Breaking the temporal cues lead to sleep disturbances, gastric problems, lack of focus, and also fatigue. If this continues chronically, sleep debt can accumulate and evidence show that there is high risk in delivering unsafe care for patients. It is also shown in research that the most common reason for medical errors was shift work and extended work hours. Aside from the sleep disturbance due to lack of sleep, shift work nurses also reported gastrointestinal problems such as peptic ulcer due to disrupted meal times, cardiovascular problems including hypertension. Also, people who do more shift work tend to have gained weight due to changes in their eating habits. This has become a growing concern as it affects one's levels of performance, therefore risking patient safety and jeopardizing a healthy workplace environment. Patient safety and healthy workplace are compromised because of the effects of fatigue, such as delayed reaction times during emergency situations, delayed thinking, and diminished memory. Given the physical or physiological effects of shift work and long work hours in the body, there are also some detrimental psychological impact on one's health. The nurse's general psychological well being is impacted due to the fatigue and social isolation they experience while doing their shift work, as opposed to nurses who do not do shift work or long work hours. It has resulted to conflict between work and social life because they need to sleep when they get back from work and do not have time for social occasions. According to studies, nurses feel that there is poor quality of life and have lesser confidence with themselves, and their mental health is affected, and the individual psychological state changes, such as they experience depression, anxiety, and stress. The shift work and long work hours affect their mental health through the lack of alertness, as it changes the diurnal preferences of the body, where we human beings are more active during the day than night. Another psychological impact that nurses experience is burnout. Burnout is when healthcare professionals may have experienced a chronic occupational stress, which inhibits them from having interest with their work or dissatisfaction with their jobs. This is often associated with prolonged interpersonal stressors on the job that it accumulates feelings of emotional exhaustion, depersonalization, and lack of drive to accomplish work. Occupational activities have always been an aspect of our lives and it contributes to our overall life satisfaction and well being. These psychological factors decrease one's satisfaction to do well in our very own professions, therefore increasing the risk of unfavorable outcomes such as increase of absences and frequently changing our jobs. This not only affects the individual but also puts the patient at risk because of the impaired concentration, feeling less empathetic, and decreased willingness to work. We nurses save human lives. Hence, if we cannot perform well, we place our patients at risk, and that does not meet our standards of practice as a registered nurse. We also not just put our patients at risk, but also our work colleagues. The increase of absences or lack of will to work places pressure on our team members, leading to unmanaged tasks. Other than physiological and psychological effects, there are also some ergonomic factors that risk patient safety and inhibits a healthy. One of them is increased musculoskeletal injuries. Often, nurses must endure standing and walking for long hours, so having a break is a great time to relax the muscles. However, shift work nurses often do not get breaks as there are less staffs present during the night. The nursing shortage has led to increase of workload, therefore increasing hours as well. This has led to increased musculoskeletal injuries due to overexertion as the body experiences fatigue and exhaustion. Needle stick injuries is probably one of the most common accidents in workplace, especially in the medical industry. Long work hours and shift work increases the chances of needle stick injuries because of lack of concentration brought by sleepiness and increases the individual's exposure to body and blood fluids, ergo susceptibility to diseases endangering patient safety and healthy workplace. Some strategies include shift rotation, educating nurses about the hazards of sleep deprivation, encouraging better lifestyle habits, supervisory support, and collaborating with leadership on policies to reduce risk. Shift rotation is when hospitals or wards implement changes in rotational roster so that the individual does not experience too much stress or overload of work. This allows the nurses to have time for other aspects of their lives and not just work. It is also seen as fairness because each nurse can experience the differences between shifts and can therefore help them organize their time better. Educating nurses about hazards of sleep deprivation allows them to understand or be informed of the risk of shift work and long work hours before they agree to take the shift allocated. It allows the nurse to ensure that they know what they're getting into and acknowledge the consequences of sleep deprivation on oneself. This also includes teaching nurses about strategic napping, where research shows improve attention span and wakefulness, therefore helping them look after themselves better and reducing the risk of nurses and patients to fatigue. Encouraging better lifestyle habits involves choosing a better lifestyle or healthier lifestyle to improve workplace resilience and focus. This educates nurses about the moderate use of caffeine, not solely relying on caffeine to stay awake. Mindfulness meditations to improve sleeping periods, napping before and after shift work, doing some exercises, even just for 30 minutes, and avoiding excessive use of alcohol or sugary foods to decrease chances of health implications. Supervisory support and collaboration with leadership mitigates risk by helping nurses have a sense of control with the work environment and improve job satisfaction, hence decreasing profession burnout. Support and collaborating with leaders allows staff to be satisfied with their job despite doing long hours or shift work, as it helps them appreciate themselves and feel that they are doing something helpful. The support and collaboration involves leadership visiting for night shift staff, keeping them informed of current newsletters, involving the individual in daily decisions, and ensuring that your team members have sufficient, healthy, and quality food available during the night. Boosting the staff morale individually and as a team is one of the best ways to mitigate risk of patient safety and having a healthy work. Let us find out. Leadership is a multifaceted process aimed to achieve a mutual goal. Leaders are often characterized as visionaries, having strong communication skills, confident with their skills, and have effective therapeutic interpersonal skills, and can also motivate other people to excel. Having an effective leader means that they can encourage the team members to gain a reformed and in depth understanding of a patient holistically to optimize health outcomes. Clinical leadership reiterates that the need to improve quality and safety. As new graduate nurses, it is our responsibility to ensure our patient safety as per our code of conduct and standards of practice. Shift work and long work hours can be draining, especially for a newly employed registered nurse. We do not only have a responsibility to our patients, but also to ourselves. The Australian Nursing and Midwifery Foundation has rostering policies that we can use as a guide if we feel that proper rostering is not being followed in our prospective workplace. It is important that we know such policies because this will mitigate risk of patient safety and healthy workplace. Practicing our code of ethics means that we acknowledge that there should be fairness and equality in the workplace, such as knowing the limitations of on call rostering and providing shift rotations to help nurses balance work and life situations. Therefore, as new graduate nurses, knowing this information allows us to take initiative of our own health and improve patient safety. Knowing your limits does not make you less of a nurse, but it makes you an advocate not only for your patients, but also to your fellow nurses. Thank you and have a good day.